school children. We've been working closely with Pitt County Schools on that. We estimate that the number of children with or students with delinquent or who are behind on their immunizations is somewhere between 1,600 and 1,800 students. And we have a series of immunization clinics coming up for that. There'll be a written press release coming out to describe the details of that process tomorrow, Amy? Tomorrow, sometime tomorrow. And anything else? No? Thank you to my staff. Thank you to Randy Gentry and his staff for helping support us through this time. And besides that, I'm happy to take your questions.
I like the tie.
Like the tie? Got to support the Pirates. We'll start. We'll start a Painted Purple Friday a little bit early today, this week. How's that?
So I'm going to jump in with questions related to tomorrow. So there are a lot of people planning on being in Greenville for the rally for President Trump. Is this a problem when it comes to COVID-19, this kind of a mass gathering?
Well, anytime you bring people together, there's potential for COVID or any other communicable disease to spread. So in this setting, sure, there's a risk that goes with that. I would encourage people who want to come and exercise their First Amendment right to do so responsibly, to wear their masks, to sanitize their hands often, and to try to stay 6 feet away from others when and if possible. But I would be careful about trampling on people's First Amendment rights to express themselves.
And we've heard the term super spreader event. The White House press conference about Judge Amy Coney Barrett was being marked as a super spreader event. So for someone that doesn't know what that is, can you explain that for us?
A super spreader event, where normally when we look at a communicable disease, an infectious disease that can be spread from person to person, there's a typical number that if I have the infection that I will give to other people. In most instances, that's a fractional number. To maybe it's 1 to 1 or a low 1 to 2, something like that. If it gets much beyond that, it's very hard to get around that infection. A super spreader event is where if the normal reproductive number is 1, maybe the number of people infected from that individual is 5 or 10. And we see that in other diseases too. For example, plague. We normally see a 1 to 1, 1 to 2, maybe 1 to 3 with plague. We've seen there are some reported instances with plague of 1 to 11. So we have seen this with COVID in other instances too. So that may very well qualify as a super spreader event.
So any concern that tomorrow could turn into a super spreader event for our community?
Well, there's multiple parts to that. There's bringing susceptible hosts together. There's bringing together someone who's very efficient at spreading the organism itself. And then having people close enough to actually contract the disease. So again, if people are spreading themselves out, if they're wearing their masks, if they're sanitizing, we should be able to minimize those risks.
And now, do you know of any other precautions that are put in place to help protect people after that's going to be happening now?
Because of the security issues with this has been very tight-lipped. We have not been involved in the planning for that. I know there's a very large aircraft, a very large military aircraft was sitting at the airport today. So the advance team is there today. We have not been involved in preparing for the crowd. I understand you have to get a voucher or some sort of ticket to go to this event. And that's done, I believe, online. But we really don't have any other details. So again, it comes back to the 3 W's, the wear, wait, and wash. And it's a lot about the spreading, the being 6 feet apart.
And now, are you concerned with any outbreaks that are going to occur after this event?
Well, as I said, there's always the chance for some spread. Anytime you bring groups of folks together, there's a chance for spread. I guess we'll have to wait and see how many people are actually there, what the mask wearing is, how the spacing is. But again, we really don't have the authority to stop that. This is a presidential event. It's a First Amendment protected event, so we do not have the authority to stop that.
Are you preparing for this in any way? Have you put anything in place in case anything happens?
We have our normal surveillance in place. We continue to do our testing twice a week and by appointment. We are working with the State Health Department on a surge testing site for Pitt County. We hope to have more information about that next week, but there's a number of details to work through with that. So we have seen a great uptick in our testing here in Pitt County. It's widely available. Each week I receive a report from the communicable disease department, a branch of the state health department. And on average, we test about 4,000 people a week in Pitt County across all providers. So we're testing something on the order of 20,000 people a month here in Pitt County, which is a pretty good number. The state, if you follow the state guidance on that, we should be testing about 9,200. So we're doing more than twice that.
And I guess you kind of went over this a little bit, but what would you advise people to do, when going to this event and preparing for something like this?
Yeah, if you are going to attend this, I would make sure that you've got a mask. I would take some hand sanitizer with me, and I would do my best to stay 6 feet away from people at the event.
One of the things that the police department tweeted out this morning was that parking is going to be off limits at the airport, so they're going to have folks park at the fairgrounds and take shuttle buses. Probably about a 10 to 12 minute drive. You get to a shuttle bus in 12 straight.
Well, I got to be careful how I answer that. Probably not, I guess. The exposure is defined as 15 minutes. So if it's 12 minutes, I guess technically you're under what is defined as exposure. Masks probably increase the time that you can be around somebody without being exposed. So there's probably some increased risk to that. But I don't know that it's means that everybody on the bus is going to get COVID if somebody has COVID on the bus.
Anything else you think we should know about this event tomorrow?
Well, again, I think that, this is something that's come up again and again in whether it's at the schools or in workplaces, social events. If you're sick, please stay home. If you're sick, don't go to that event. Don't take the chance of spreading this infection to others or any other infection to other people for that matter. People die of the flu, people die of other infections. So it's not just COVID that kills folks from an infectious disease standpoint. If you're sick, please stay home.
And I guess one last thing, do you have any concerns for this rally?
Well, I have concerns anytime you bring a group of people together. As I said, we will be monitoring folks. We will continue to test folks. We will look at putting that question into our tracing protocol to see if folks were at the rally. These type of infections, these droplet-borne respiratory infections, are difficult to contact trace because sometimes you're not always sure who you were exposed to or who you may have exposed if you're the source person. So, but we will certainly be vigilant looking for that and following our county numbers.
And I wonder if you've had, this is kind of switching gears a little bit, any conversations with Board of Elections members about protections while people early vote starting tomorrow? Because there's been long lines, we've seen it across the nation. Is there any protections that are going on in place here in the county?
Yeah, I know they have worked on their spacing and sanitization protocols so that people don't bunch up. Polling places are going to be spread out more. There will be, little enclosures around the voting, both for privacy and those privacy enclosures help reduce the chance of spreading this infection. We're happy to consult with them or work with them on anything they need help with, but they have been following the state national guidance on this and seem to be doing a good job. Oh.
Oh, Elizabeth, I'm sorry. No, you're okay.
She's so quiet.
I didn't have anything related, so I didn't think about that.
And no, I don't have tickets to the president's event tomorrow.
I was just letting y'all talk about stuff. Anyway, so we've seen an increase in hospitalizations across the state. So, are there more hospitalizations expected locally and statewide with reopening?
We have seen statewide the numbers have trended up. Some hospitalizations are back up statewide. Hospitalizations tend to be a little bit of a lagging indicator. They're a week or 2 weeks behind sometimes the date that someone acquires the infection. Our numbers here in Pitt County, even though our total case count has gone up, if you look at our surveillance curve, the curve actually is still kind of trending down. So we'll see if we bottom out and head back up. So, I'm sorry, Elizabeth. Balance of your question. Can you repeat your question?
Okay, sorry. So, are more hospitalizations expected?
More here. That's hard to say. Most of our case growth has been in the 18 to 24-year-old age group. Second is the 25 to 49-year-old age group. Those folks are at lower risk of having hospitalizations, but we have still had some smoldering outbreaks in some of our long-term care facilities. We'd love to get those closed, but sometimes they just, infections creep up in those places. So when we look at age-adjusted mortality, while our global mortality rate is about 0.6, if you were to calculate an age-adjusted mortality for the 75 and older age group, which is where the bulk of our deaths are, 57% of our deaths are in that group, it's about 8.5%. So they're much more likely to have a worse outcome and even potentially a fatal outcome in that age group.
Okay, so most of the hospitalizations are among these older?
Well, the hospitalizations in this, Vidant puts out their system numbers. Those are not all Pitt County hospitalizations, so they're from across their 29 county catchment region. I do see a report from them usually once a week. I did not look at the age distribution in that. We do see some younger folks, some folks in that 25 to 49-year-old age group who are sick enough to be admitted, and even occasionally admitted to the ICU, although their chances of survival are very, very good in that age group.
And these are, so, sorry, just I didn't miss this, but do you expect more hospitalizations this year?
I think we've trended up a little bit, so I think they will continue to see a high volume, probably in the range that they are now. They're a little better than they were at the peak a few weeks ago, but they're still above 100. Earlier in this, they were running in the 40 to 60 range across the Vidant system. And again, I want to mention I don't speak for Vidant per se, but I would estimate that yeah, we will likely see some more hospitalizations as we continue to burn through this.
And schools are beginning to see more cases, so do you think this will be a problem as more students return to school?
We've worked very closely, at least with the public schools. Private schools are a different story. We've worked with a number of the private schools as well. We work with them just the same as we do with our public schools. Our public schools are going to return to 4 days a week instruction through in the K to 5 age group. I would say when you look at our county data, the 0 to 17-year group has been about 8% of our data and been flat at 8% of our data for several months. So even with schools reopening, we really haven't seen a bump in that. So I'm hopeful that we will not see a bump in this. Again, we continue to see isolated cases in both students and faculty and staff at Pitt County schools. We do not necessarily find transmission within the school. And we generally, when we look at these, we find that the transmission likely occurred outside of the school and it was brought to school.
And this weekend, there's going to be a football game. So what measures are in place to ensure the safety of those kids?
The university is only allowing 3,500 individuals into the stadium. They will have social distancing in place, and again, I don't speak for ECU. Their food service will all be prepackaged and available prepackaged or delivered if it's a box or whatever. They will be mindful of not letting people congregate in places like the bathrooms and the stairwells. Yes, when I did my tour, that was one of the vulnerabilities we identified as where could social distancing break down, and potentially in the bathroom. So they were going to do some marking in the bathroom to try to remind people to maintain their distance in the bathroom. They were also going to have monitors in the bathrooms to make sure that people did not bunch up in the bathrooms. They were looking at their food service to make sure that people didn't bunch up at the counters in line for food or beverages. So, and then when they exit, people, they can stagger, and they do plan to stagger arrival times for people. Oh, you're welcome. And then the exit, because while people may want to arrive at different times for a game, once the game is over, pretty much everybody wants to leave. So we did talk about making sure that traffic is one way out of the stadium, and that they don't allow for bunch up of fans in the stairwells or other places as they're trying to exit the stadium, because that's a area where the social distancing could break down.
And there's a lot of large events in Greenville this week. So how much virus spread do you think we're going to see in the community, and what do you think we're going to begin to see in the
Yeah, hard to say. Hopefully, if people adhere to social distancing, masking, and hand hygiene, we will have minimal transmission in those. Typically from exposure to disease onset on the short end, 1.5 to 3 days. Some people are saying the median is now 5 days. So for us to get somebody tested, probably a week, and the full incubation period for an exposure is 2 weeks. So over the next 2 weeks, if there's a a surge in activity, we may be able to say, hey, that's from an event here in town.
And do you expect to see a spike in cases?
You know, we have been lucky. We did not see one after Labor Day. We really have not seen much of a spike with the opening of public schools. So I'm hopeful no. So I'm going to hope for the best, but we'll be prepared for the worst if cases do happen. All right. Thank you. Good.
Perfect, thank you.
All right. Thank you, folks.